Dear Professor Johannes Vester, as President of the Academy for Multidisciplinary Neurotraumatology, could you please share us your thoughts about this organization upon reaching the important milestone of its 20th Congress?
Thank you very much for that question. And you know, after that long pause after COVID-19, the last Congress was 2020 in Egypt. We all realized here again the importance of face-to-face communication to really move things forward. So important for the benefit of future patients. This interdisciplinary sharing of scientific perspectives openly, in an open, respectful way, in a respectful framework, as we do it here. This is of crucial importance for a better understanding of the complex and really very complex nature of neurotrauma, especially traumatic brain injury, and also for developing successful new treatment concepts by putting all these aspects together to capture the full picture of neurotrauma. Because neurotrauma is multidisciplinary. It's multidimensional from its very nature. And AMN, as the Academy for Multidisciplinary Neurotraumatology, is dedicated to open the mindsets to this, to communicate the breadth of perspectives necessary to capture that full picture of neurotrauma and recovery. And maybe as a message to our colleagues here present at the 20th Congress, I would like to say that it's extremely important to open new perspectives for the future on high scientific levels, sharing the experience of all the experts with the audience, learning from the past, and communicating to clinical practice, and also very important, closing the feedback cycle by listening carefully to the local practitioners. So this is really something coming together of all this information from top scientific level to bottom down local conditions, and that has to be a living feedback cycle to really move things forward. That's our aim.
So in connection to your answer, the Academy is currently working on the setup for a new guideline in partnership with several affiliated societies. What will be the priority topics that these guidelines will address, and what added value will they bring to the Academy's institutional network?
Thank you very much for this question. Well, as I said, due to the complexity and vast heterogeneity of neurotrauma, especially in traumatic brain injury, I would say many clinicians are left alone in terms of modern guidelines in this field based on evidence-based pillars. So while there exist a lot of neurosurgical management guidelines, there exists, to our knowledge, no treatment guideline yet incorporating this complex multidimensional nature of TBI in the early recovery phase, initiating treatment options in the first 24 hours. And for instance, as stated in the most recent Center TBI elaborations on the outcome instruments after TBI, published just this year, it is recommended that multidimensional outcome assessment is performed for a comprehensive representation of patients' clinical picture. And this is a very important aspect. It requires all of us to make a big step forward from that focused single outcome assessment approach, which only can look for a specific angle to the patient. Of the past, that was the methodology of the past, to addressing the multiplicity of important domains as physical function, cognitive function, emotional, mental health, global functional outcome, and so on. So to close this gap, we will focus in this guideline on these most relevant domains of interest for all patients undergoing early recovery after traumatic brain injury. And of course, the aim is to help for clinical decision-making by any healthcare professional involved in TBI neurorehabilitation.
Professor Vester, thank you for this most comprehensive answer. On a scale from 1 to 5, where would you place the implementation of GRACE principle for high-quality observational studies of comparative effectiveness in TBI research?
Nice question. Easy answer, score 5. Why? As you know, an observational trial in terms of the GRADE framework where the evidence is rated if it comes to treatment recommendations. The observational trial enters the door with the rating low evidence. That's the starting point. Now, in practice, observation trials are not so good, mostly controlled. There are a lot of loss to follow-up of patients. And so they are further downgraded from low to very low or no evidence. What does that mean? We invest ideas, resources, energy, dedication, passion, financial grants to observational trials, which at the end have no chance to be of any value for the community when it comes to rating the quality of evidence, because they are rated with very low or no evidence at all. So when it comes to guideline production, they have no value, and they're left with the final statement, no evidence. That's why score 5.
Professor Vester, what do you believe are the main elements of the modern multidimensional approach that any TBI researcher should be guided by?
Yeah, important question. You know, outcome of TBI is by its very nature multidimensional. Human beings are multidimensional. There is not only a physical function to be restored, there is emotional, there is mental health, there is social reintegration, a variety of aspects important for the quality of life for the individual human being affected by traumatic brain injury. And unfortunately, there is still a widespread treatment nihilism about cognitive, behavioral, and depressive disorders in acute care. This has to be changed. We have to change that if we want to effectively bring the patient back to what he has been before the trauma. All these aspects play a major role for this individual being, and we have to open up our focus. All of us have to open up the focus to the breadth of these long-term impairments so important for the patient, and also his relatives and family and beloved ones.
Thank you very much. Last but not least, Professor Vester, what are the main future developments the Academy for Multidisciplinary Neurotraumatology is focused on, both short and long term?
Okay, thank you very much. I would say, first of all, and basic focus of the Academy is still to further open the doors between the academic disciplines, to bridge, to take away the walls which inhibit that we really share knowledge and come to a bigger and more successful picture and a potential to help the patients. So this intense multidisciplinary exchange of knowledge and the different perspectives with the aim to establish effective pathways for the treatment of neurotrauma patients. That's the basic of this multidisciplinary academy. And to say a second focus crystallized most recently to promote modern research approaches, to help that to come to life, interventional or non-interventional, by what? By providing in-depth methodological support and by offering the umbrella of AMN to endorse promising future-orientated clinical research. And this way, I would say AMN is seeding projects from which new therapeutic options are expected and which address the breadth of potential deficits and recovery following neurotrauma. And maybe a third focus to mention is the, as we are all here, the enlargement of educational and teaching activities, also very important to close the feedback cycle. And just to mention, the Neurotrauma Simulation Center was already successfully implemented last year in Vienna, also this year, with participants from 6 low-income countries with a variety of disciplines, neurosurgeons, neurologists, psychiatrists, psychotherapists, and so on, all exchanging their knowledge and their experience. So this teaching domain will be further strengthened in the future and extended so that AMN might become a kind of key transmitter of interdisciplinary knowledge in neurotrauma. So a lot of exciting developments, a lot of work still to do, and I would say we encourage young clinicians and researchers to join our organization and become part of this exciting AMN academic network. Thank you very much.
Professor Vester, thank you very much for this interview, and I wish you best of luck in all your endeavors.
Thank you so much. You're welcome.